In this video, I'm answering all your questions from comments, emails, social media messages, so stick around. Hi guys, I'm Dr. Lane from Adelaide, South Australia. Thanks heaps for subscribing to my channel. I know I get lots of comments on my videos and sometimes through social media. While I can't offer medical advice over social media, I'm always happy to try to answer general questions. So in this video, I'm going to go through some of those questions, hopefully to shed a bit of light. Okay, so first question, is herpes curable? I've actually done a video on this one. There isn't currently a cure for herpes. They are working towards a vaccine, I believe, but I'm not really sure when that's going to be available. There has been talk that it might be going into trials within the next few years. The good news is there is treatment. That's normally antiviral therapy. And you can take that if you get an outbreak, but you can also take it continuously if you're prone to getting outbreaks to try to reduce the frequency of those. Can you get an STD if you've never had sex? Okay, so this is a really common question I get asked. Sexually transmitted infections, by definition, are transmitted through having sex, and that's typically because they are transmitted in body fluids like semen or vaginal fluids, even rectal discharge. So it's really unlikely to get infections like chlamydia and gonorrhea in the genitals if you haven't had sex with somebody. Now, there are cases, of course, that you might still get exposed to a sexually transmitted infection. One would be if you're sharing sex toys. So technically you may not be having sex with somebody, but if you use a sex toy that somebody else has used, there might be a transmission that way. And then don't forget, there's a whole lot of other infections which might be associated with sex, but not necessarily sexually transmitted. They include things like warts or even herpes, which you can get from cold sores or sharing glasses with people. As always, if you're ever worried that you might have been exposed to an STI, my best advice would be just go and speak to your doctor. Okay, next one. Why do doctors always recommend circumcision? Actually, we don't. In Australia, for example, routine neonatal circumcision for baby boys is not something we recommend at all. And in fact, it's not even covered by Medicare, which is our national insurance, unless there's a medical reason to do so. Some people do have to be circumcised. Like, for example, I've had patients that come in with a condition called phimosis, which is a scarring of the foreskin. And we try to manage that conservatively, but if it's really severe, like if it's obstructing their ability to go to the toilet or creating a lot of pain when they get an erection, then sometimes the only option is to do a circumcision. Okay, can a male receiving oral for a very short period of time contract an STD? So STIs can be transmitted through oral sex. Again, I've done a full video on this one. I'll put the link in the description below. You can get things like herpes from skin to skin, particularly if somebody has genital herpes that could transmit to the lips or vice versa. There has also been cases where people have had chlamydia or gonorrhea in their throat, and that can then be transmitted to another person if they give oral sex later on. But by and large, if you've received oral sex from somebody without a condom, it's normally considered fairly safe. Of course, if you're worried, do go to the doctor. You can easily do a test to check for any infections. What is male thrush? So male thrush is better known as balanitis, and balanitis is an inflammatory condition that typically affects the head of the penis, more common in uncircumcised men. And contrary to popular belief, a lot of people think it's caused by poor hygiene, but often it's not. Now, if you're uncircumcised, you might have been told you need to wash every day under the foreskin with soap and water. I would advise don't do that. Soap can actually really irritate the head of the penis, which is very sensitive skin. If you're going to wash, I would just use plain water or some sort of a soap alternative like QV wash or Sorboline. You can normally buy these at the pharmacy or even a supermarket. When you do get balanitis, it often presents with these tiny little red bumps that happen on the end of the penis. People often freak out because they think it's a sexually transmitted infection, but it's not. It can be associated with an overgrowth of yeast, which is probably why it gets the nickname male thrush, but the treatment is quite different to how we treat thrush in women. If you do think you've got balanitis, it's always a good idea to go to the doctor and just get a second opinion. But one of the easiest ways to get rid of it is to stop using soaps and just go to once a day with water, or as I say, a soap alternative like Sorboline. Okay, if you get exposed to an STD, is there an emergency pill you can take? Well, that completely depends on the type of STI we're talking about. So for example, if we're looking at HIV, there is actually something called PEP, and PEP is the same medication that people who have an HIV infection take, but it's administered to somebody within 72 hours of being exposed to HIV that doesn't already have the infection. And the idea is if you start taking that medication quickly before the HIV infection has a chance to take hold in your body, then you can get rid of it completely. With other STIs, however, things like gonorrhea, chlamydia, look, I guess technically you could take antibiotics, but normally what we would say is wait and get a test about 5 to 6 days later, unless you've got symptoms in the meantime. Now check out some of my other videos, guys. I'm putting a link on your screen right now, and don't forget, stay healthy. I'll see you soon.